Thank you guys for coming. We really appreciate you coming out on a weeknight, especially there's a lot going on in the animal world this week, a lot on everybody's mind, so we really appreciate you taking time to come. And it's also back to school for our students here and for everyone with little ones, so I really, really appreciate it. My name is Emily McCobb. I'm the director of the shelter medicine program at Tufts and the assistant director of the Center for Animals and Public Policy. So we have been doing a lot of work as a school about thinking about who we're serving as veterinarians and who's in our community. And it's a research interest of mine, and people are aware of our clinical programs and how we're incorporating into teaching. And we're fortunate that we live in a state where there's a lot going on. So we have a lot of animal welfare groups involved in programs or potentially thinking of starting programs or already national leaders of programs. So we just want to take an opportunity to kind of take a step back, learn from some experts from across the country, and kind of consider our programs. And we also know that in the veterinary community there's concern about some of these programs, and so we wanted to kind of just continue the conversation and start having open dialogue to consider all stakeholders. The MVMA has taken a leadership role in this. I was fortunate to serve on a task force with Dr. Sosnicki actually chaired it, sitting over there, where we kind of considered these issues, and we had practitioners who work for nonprofits and practitioners who work for for-profits working together. We actually did a survey of MVA members, and what we found was that the support for accessible programs is pretty high in our area, but there's still some areas of concern. There's still some touch points. So we really felt as a task force that continuing conversation would be helpful for everyone. And so the school we like to think of ourselves as a broker. We can bring folks together. So we reached out to the MVMA. So I know we have MVMA members here. We reached out through Mass Animal Coalition. So I know we have MAC members here. And then we have students and general supporters. So I actually know, I think, almost everyone. And I know that we have students, and we have veterinarians, we have staff, we have animal welfare groups from across the state, but I don't know that everyone in the audience knows. So if I could just have everyone who's a student raise your hand, and everyone who's a veterinarian raise your hand, and everyone that represents an animal welfare organization of any shape or size, raise your hand. And anyone that's staff at Cummings School, raise your hand. Okay. So with that, I'll just explain how we're going to do the discussion. So I'm going to introduce our panelists. We've been really lucky to have a great group visiting with us today. I can't believe they're still upright because I'm exhausted and they still have another day to go tomorrow. But I'm going to introduce them, and we have some more of their team members also to help me in the audience. And then we're going to and then they're each going to tell you a little bit about their program, where they are, who they serve, how they work, and then we're going to open it up to questions. And I'm going to run around like your talk show host. I don't even know who's the talk show host today. I used to say Phil Donahue, and my students are like, who? So that way you can have the mic to ask your question, and we won't have to repeat the question each time, which gets awkward. So I'm kind of slow, so wait for me to get up to you if you have your question, and then we'll try to have as much discussion as we can have. So our panelists are Dr. Carolyn Brown, who's director or medical. I wrote it down because I knew I'd forget. Senior Medical Director of Community Medicine at the ASPCA. And she's been at the ASPCA in New York City for 6.5 years. Before that, she worked in private practice and also in some shelter settings and a number of different practice types, so full spectrum of veterinary experience. Dr. Greg Wolfus. Dr. Wolfus directs our Tufts at Tech program, which is our school's program, and every student at the vet school goes through that program for 3 weeks, and many do many more weeks. And prior to that, Greg and I both worked for VCA, so we have experience in kind of the corporate veterinary world. We used to fight about our clients back and forth. And then he kind of saw the light and came to work for us. And then we have Amanda Arrington, who is the founder of Beyond Fences, which is a direct client outreach program that we're going to hear more about in North Carolina. But she's now probably better known for starting Pets for Life, which is a big initiative of HSUS, which a lot of us really look up to that as like the model program. And they're across the country and really doing amazing things for animals. So I'm going to hear more about that as well. And then Laurie Hensley, who is kind of runs the Beyond Fences, so really doing a lot working with clients in the community where they're from in Durham, North Carolina. So with that, I'm going to let each of them kind of tell you a little bit more about what they wanted to share with you about their programs.
Hi. So the ASPCA's community medicine program serves a number of different communities. We work in both Los Angeles and New York. And in each city, we go out into the community. Our services for the community are mostly done through mobile clinics. So we're actually literally in the community, and we provide both spay-neuter services and primary pet care. And we define primary pet care as basic and preventive care. So we provide vaccines, dewormings, and treat pretty much anything that you would think of as being treated and taken care of during a normal office visit at an animal hospital. And we do that, as I said, in New York. We have a couple of different communities that we focus on. And in Los Angeles, because the needs of the community are different, we focus more on shelter intake and work with county shelters.
Hi guys. I'm Greg Wolfus. I know many of you, but there's some I don't. I do work for the Cummings School, full disclosure, which is also Tufts University. But we work at Tufts at Tech, which is a community clinic that it's embedded in an urban high school in Worcester. And our mission is to teach two student populations, the Tufts fourth-year veterinary clinical student, along with a high school student. These are urban high school students who are working towards getting their veterinary assistant degree. So these two student populations work side by side in the clinic to provide very similar care to what Carolyn Brown and team are providing. It's primary care, it's all outpatient care. There certainly is plenty of well care stuff like vaccines and heartworm tests and all that, but there's also a lot of urgent care from the community in need because our target client population has very limited resources. About 90% of our clients make $25,000 a year or less, and we provide reduced cost, subsidized veterinary care at about a quarter of the national average. So it's not free, it's a partnership with the community to provide care, and they're kind enough to let our students grow and learn from the experience. And it is the main primary care center for the vet student at this point in time. So while I do at some points in time think that we're helping provide access to care for our community in need, and it's the greater Worcester area, I also really, really firmly believe that the most important part of our clinic is our teaching mission, and we're trying to teach these veterinary students and these high school students how to be compassionate, how to think up flexible treatment plans and work with the people with whatever resources or opportunity they have. And I think even more important than that is making them just be good people who are going to want to continue doing this kind of work later. So like the best joy I have is when a very dear student of ours goes and starts working for the ASPCA in LA or with one of these people, just creating a larger workforce of people trying to make a difference.
And we appreciate that.
Yes, very much.
And I'm just going to point out, I don't know who set this up, but they have the veterinarians on one side and us on the other side. Just wanted to make that clear. Hi, everybody. I'm Amanda Arrington. I'm the director of Pets for Life with HSUS, and we are a program that focuses on increasing access to pet resources for people and pets living in underserved communities. We're currently operating in 34 communities across the country. We do direct care in a couple where we have our own staff that are out in the community delivering services, and then we help facilitate and train local organizations to do the same in their communities and to make pet owner support and community outreach part of their organizational mission. And then we also just work sort of largely on issues within the field, specifically with policy and enforcement reform, looking at issues of institutional bias and discrimination that has impacted communities with high rates of poverty and communities of color, and how that trickles down to impact people's lives with their pets, and what the pets mean to people. And so wanting to really be a resource and connecting people to what they need and want for their pets.
And I'm Lori Hensley, and I actually work with Amanda. I met her about 10 years ago at a party, and I was drawn to her because she was talking about she had just wanted to start this group. She was just getting it started called Coalition to Unchained Dogs. And she had this idea that she wanted to go into the community and she wanted to build free fences for dogs that were chained in our community. And that really interested me because she really, it really came across from talking to her that she was interested in helping people keep their pets and not going in and judging them for having chained dogs. And that was an approach I had not heard of in the animal welfare community at that time. So I was really interested in starting with her and joined on immediately and started going and doing outreach with her on Saturdays. And we both, I think, realized almost immediately that chained dogs really weren't the problem, that the problem was poverty, and that chained dogs were just a symptom of that poverty, and that once we stepped back and said, maybe we aren't the experts, maybe what we need to do is listen, and we did a lot of that for years. We learned that what the community really needed was definitely fences for their chained dogs, but they also needed access to resources that they just had never had access to before. And one of the main things that we now provide is veterinary care, because it is something most people we meet have just never had access to. So we started out as Coalition to Unchained Dogs, and we recently changed our name at our 10-year anniversary to Beyond Fences, just to kind of reflect that we do so much more than the fences we build for the chained dogs, that we really do provide comprehensive resources to people living in underserved areas of our community.
And I'll just make a note that meeting someone as great as Lori just validates that it's good to hang out and drink.
Okay, so before I open the floor, I realized I forgot to do my thank yous, which I was supposed to do. So I just want to thank the Lawrence Fund, who funded us, all of our guests for coming and traveling, and the ASPCA Community Medicine teams for being here, and especially Ginny, who really does all the behind the scenes, make sure we have AV.
Ginny, you're amazing.
Food. Yeah, and so thank you. Okay, who has a question? Have questions.
I know someone has to get it started, and then it'll just...
I'm coming.
Full disclosure, that's Liz Rosansky. She works for the Cummings School also.
I also work for the Cummings School, and I'm an ER doctor, and I have actually a really hard question for you, or I perceive it to be a hard question, which is, how can the emergency veterinary population reach out to this community? Because I think there's a tremendous number of ER doctors that have downtime in underserved areas and would love an opportunity to partner with somebody to treat some of these animals. And then the second part of being an emergency doctor is, as everyone in the room who has done ER knows, is people come in, they love their dogs. It's a dog that has a pyometra, and that cost is excessive at that time point. So how can, I guess my question is, how can Accessible Care partner with ER, or how can I as an ER doctor with a lot of ER doctors partner with you guys?
Who wants to start? No.
Are you going to have a
No, you go. I will say that emergency care is there's a great need for it, and just to share a couple of statistics. So in our PFL communities, we've now served over 130,000 pets across the country, and we've collected the same data for all of them. So we really have this sort of nice snapshot of what it means to be a pet owner in an underserved area. And 3/4 of the pets have never seen a vet before, and the ones that have are almost always for emergency situations. And so they're having to wait until the condition is dire or there's just been a traumatic event. And one of the biggest problems that we see with emergency care is just how expensive it is, even for us as a program. If we're subsidizing services for our clients, when it's on a weekend or it's, in the evening, that we're just not even able to afford, So we have some partners in emergency care, and the biggest thing is trying to come up with a plan that is financially possible, and what that means, what the limits to that might be. And so I think with emergency veterinarians, just having more of a conversation, it sounds sort of, like not an answer, but I don't think we have enough conversation over what emergency care looks like, and what might be feasible.
So I agree 100%. I guess what I'm thinking about is there some way we to
get involved like whenever you have free time?
So that there's an awful lot of potential downtime, and if we say, hey, this certificate, can you guys vaccinate? You guys are here all the time. You know Tuesday nights are quiet. This is people aren't at work. This partnership is, so not for sick dogs. I agree that can be very expensive, but for getting them in the door, trying to partner with some of the bigger ER groups. There are a lot of corporate practices say, can we do, 30 cases a month of vaccines and this checkup, and we're going to give you PR for supporting us. The vets are then feeling like they're giving back because they're able to do that. So the ER part, I don't know how to fix, but I'm saying mobilize those ER doctors to help vaccinate and spay and neuter. A lot of them would love to do more surgery, and surgery is getting taken away from them by the surgeons in some of those practices. So say, hey, you're going to drop off your dog. It sounds funny at 8 p.m. and you're going to pick her up at 8 a.m. spayed. Good luck with that. So that's what I'm looking at as a model, because I think that would be something that would be fun for the ER doctors and also help you guys get a better reach in the community.
So I have a question back for you. Is there sort of an association or any sort of like that emergency vets talk to each other and get together where the information can be disseminated?
Yeah, so we have giant meetings.
Because if not, you can just travel around with us.
So there's a big emergency meeting. It's in Nashville this year. It's attended by about 4,000 people. And one of the big questions I get is I constantly talk about Tufts at Tech there, and people saying, "Gosh, I love being an ER doc, but I wish I could have a way to give back." And so I feel like we have a group of people that, they would need some, like, what vaccine do you give? But gosh, that's actually pretty straightforward, relatively straightforward. At least a rabies shot and a parvo shot, or Prevo shot. But that sort of stuff, and the spay-neuter stuff, especially for that surgery, they like that, and say drop off your dog, and it might be that if we get really busy you get bumped till tomorrow, but it's still using a SNAP coupon or something like that. So that's there's a ton of ER docs that would love to do that, and I think it's a matter of convincing the VCAs and the Blue Pearls that this is a model that they would like from a PR standpoint. The hit by car dog, I don't have a solution for that, but the other stuff I think we do.
I would love an opportunity to talk to that audience. I don't know how we can make that work, but with us operating in a lot of different communities, if we could mobilize in that way, and people that live in, across the country, if they all come together and we can give the information, I would love for veterinarians that are interested to know of them and to be able to share information about our program and get them involved. Because having after hours opportunity for surgeries, it would be great. And you were saying?
Yeah, in Raleigh, which is right next to Durham, we have a small animal emergency clinic, and they will do our cats at night when they're not busy. We drop them off, and same thing. It's wonderful.
So can I get information from you on that meeting? Okay.
So I have a not so hard question. Looking back at how each of you got started with what you're doing, what would you have done differently, or what worked when you approached the local veterinary community to help them support or understand what you're doing and why? And if you were to do it over again, is there something that you wish you would have done differently? I'm from the Animal Rescue League of Boston.
Okay, I should start that as veterinarian.
I can start. So I'll say that the ASPCA in New York City has had at times a really rough relationship with local veterinarians. And right now it's a lot better. And I think the reason it's a lot better now is because we have really defined more clearly who we serve. And we have, as I said in the opening, we serve primarily through mobile clinics. And we used to be less, 6 years ago, we were much less discriminating about where we put our mobile clinics. And so they could have been in a place that was visible to a veterinarian in a practice. And over the years, we honed that back to being, looking at communities that had high rates of poverty intake, where there were resource deserts, and started to hone back more and more where we put our mobile clinics. And at this point in New York City, we serve We say we serve the whole city, but in reality, the majority of our clinics are in two specific areas. One area in Brooklyn called East New York, and also in an area of the South Bronx. And we actually really concentrate in those two areas. And when we talk to our staff, our team, about changing this philosophy and really concentrating in those two areas, one of the questions that our team asked us was, well, how will the veterinarians in those areas respond if we're really concentrating in those areas? And the answer was really easy. There aren't veterinarians in those areas, and so we have received, I think, literally no pushback on really concentrating services in those two areas. And so when you say, if you had it to do over again, what would you do? And of course that's not possible because I didn't know then what I know now, but if I had it to do over again, and I could know this, I think that we would have started targeting and focusing more from the very beginning and never have stirred up that hornet's nest of possibly competing, even though it's not really a competition, but possibly being perceived as competing with private veterinarians. Whereas now where we are, there's no question that we are competing with private veterinarians because there are none where we are.
When you say there are none, do you know how close the closest veterinary hospital is?
I'm gonna look at my colleagues.
Close in New York City.
Yeah, not travelable easily in New York City with a pet, which might just be half a mile.
Okay.
But in New York City, that's a big deal.
I'll apply that outside of New York City. And the communities that we operate is we always start with the community assessment. And so we look up where are the current resources, so where are the veterinary offices, where are the pet supply stores, and map that out so we have a visual representation that has really been helpful for us in sharing with veterinarians to say, okay, this is our focus area, here's where you are, and here's where all the other vets are. And so we really try hard to connect with veterinarians whenever we're starting in a new market so they know up front what we're doing. We don't wait for there to be backlash or for there to be people that, sort of find out after the fact. And there are still a lot of veterinarians that have concern in the beginning, and we understand that. And so we try to apply the same philosophy that we do in the way that we connect with the community we serve, is that we want to listen to what the concerns are, try to do as little talking as possible at first, and then just share information. And then the data collection has been everything for us. It is what's allowed the program to be successful and has allowed us to really avoid a lot of battles with the veterinary community, is that we're able to show not only where we're focused and why, but then we can prove that and show people that over time with looking at how many pets have never been to a vet before, how many pets are unaltered when we meet them, how many have never reached out to a local service. And I think that it helps when people can see those numbers to put their minds at ease a little bit, even if they still might have, some hesitation. We ask veterinarians, you don't have to necessarily be on board, and we're not expecting that, but if you can at least not oppose us until we can share information with you and show you what we're doing, then that is a success in our opinion. We had one vet just in the last year that was a really great example in Idaho. It's a very rural community, one of the most rural communities we work in. The county has about 500 people, and there's one vet, so our community assessment map pretty much was just nothingness. And so it didn't sort of have the same impact that it does in some other markets. And so we went and met with this veterinarian, and he was okay. And he just said, you know what, if you want to do it, but it's not necessary. He said, I know everybody in this community. I see probably, 90% of the pets. It's just not going to be the same here as it is everywhere else. And at the end of the first year, we had served about 400 pets, and about 85% of them were unaltered. And so we went back to him and said, we just want you to know that this is what the program has done. And he was stunned. He really, truly believed. He wasn't meaning it, to be argumentative. He really did think that what he was doing had served the community, and he was reaching everybody that needed to. And so us really talking to him and sitting down with him at first, I think made him have a little patience with us and give us a chance. And then we were really, really adamant about following back up with him so he knew exactly what was happening. And now he is a huge supporter and is one of our partners in providing the services to people.
I could speak about Tufts at Tech. I can't take the credit for the success part of the equation. There were people before Tufts at Tech started who were very thoughtful. And by going into the community in Worcester and the housing authority and working in outreach teams, they collected information and found out the needs that the community had. And then as the ideas of the clinic were coming together, they proactively wrote letters to all the practitioners in a 10 to 15 mile radius and alumni and said, hey, we're thinking about starting this community clinic whereby we're going to utilize teaching services to do what we're going to do. And then when I was hired and I was started, I actually just picked up the phone and cold called the veterinarians that were written to letters that had any communication to see if they wanted me to come talk with them or meet, similar to what they're doing with the local veterinarians. I probably got about a half a dozen people who were interested in meeting and maybe a dozen people who wanted to talk on the phone. But I can't take credit for the thought process, but front loading it, being transparent, and letting them know that they're part of the team. I think like the success that she had with Dr. Idaho, I think the community needs this and we're all here together and it's not competition. We're just trying to provide care to those who aren't receiving it, So I would say there are many a veterinarian in this room, some of whom are associated with the MVMA and some of whom are private practitioners. And maybe they can speak about their experience in Massachusetts with Tufts at Tech and whether they felt conflict or competition. We're in a strange state, right? So maybe there isn't going to be as much resistance, but I'm happy to entertain it and discuss if anyone wants to.
One more question. So right now, Tufts at Tech has been around for quite.
Making you work out. Tufts at Tech has been around now for quite some time. 5 years. Thank you, Emily. Is there any pushback now or any concerns now with the local veterinary community since they know what you do and understand what you do? Or at the beginning there may have been some issues, but now everybody understands it, so it pretty much goes pretty well?
I haven't had a veterinarian contact me over a conflict issue or even on email or Facebook or anything since we started. So there's been absolutely zero conflict. I've had some conversations with people. The biggest conflict I would have is some veterinarians locally that want to refer even more complicated stuff to Tufts at Tech, and we don't have the means to handle those things in that clinic. That's probably the closest we've come to conflict. But I don't feel any sense of competition conflict. In fact, I get constantly asked of when are we going to do more?
Hi, I'm Janet, and I have been working as a shelter veterinarian and a spay-neuter veterinarian for the past 3.5 years, and I also work occasionally at the spay-neuter clinic here at Tufts. So a lot of these programs that we're talking about is serving a population below poverty, so they're on some kind of state or federal assistance. Is there any conversations being had about people that are not below poverty level, because there is a huge continuum, and I think that the issues are a lot deeper than just people in poverty. People who are, just regular old people with family, 3 kids, they cannot always afford care either, and it's not easy for everyone, and everyone has their ups and downs and lows, and I was just wondering if there's any conversations on that being started.
Can I say something real quick? And then I guess far away. Just to clarify, Tufts at Tech currently means test their population of clients, and we identify that they have extremely limited resources. That being said, we're all kidding ourselves if we don't think that there's this large section of working poor that aren't receiving access to care. It's not the mission of Tufts at Tech, and there probably is some conservatism based on the university side of we have many local practitioners, And the closer we creep potentially into a working poor environment, the more likely a small business leader might be feeling that you're tugging away some resources from them, whether it's reality or not, and perception matters more than reality. So I can only speak for Tufts at Tech, but I want these guys clearly to speak because they have other things.
We actually talked about this a little bit earlier I don't know if any of those guys are here. I think that what you're hitting on is a problem within the veterinary profession as a whole. And I don't think that the affordability of veterinary medicine, as you said, is just a problem for people in poverty. It's not even just a problem for the working poor, as you so eloquently said. It's really a problem for everyone except maybe really upper middle class and higher. The veterinary profession has kind of backed itself into a corner by providing more and more specialized care and more advanced care. Those things are really expensive, and it's a really great thing for the profession to be able to provide those things. But at the same time, we need to, in all aspects of veterinary medicine and in all types of practices, have flexibility to be able to offer practical treatments and not require, like we said earlier, not require the gold standard of care or we won't do anything, not require things that are done for completeness that don't really add to our decision about treatment. And so I think what you're hitting on is really a big discussion about where the veterinary profession is going in general, and not just a discussion about people in poverty. I mean, they may be the most hard hit, but it's a discussion for the profession.
And for us, from Beyond Fences, from day one, we've never had a means test ever. So if someone reaches out to us and needs help, we try to help them as best we can within our means. We've never had. And we have found that, like, we do target a community where I think in my county of Durham, the poverty rate is around 18%, and in the area we serve, the poverty rate's actually about 40%. But 60% of those people living there are, quote unquote, not on the poverty level, but let's face it, they're hovering right around it, right? And they still need help, so we don't have any sort of means testing.
And same thing with Pets for Life. We don't do means testing. We do have areas that we focus on, but within those areas, we recognize that not everyone's going to be under the federal poverty line, and that's okay. But I think what they're saying is really important, that it's really a bigger conversation for veterinarians. It's almost hard from the outside to have, that I think is within the industry, that it does need to be looked at, because there is just a really major portion of the pet owning population that veterinary care is just financially out of reach. I think that it's over half of American households now make under $60,000 a year. And so that doesn't have to be anywhere close to the poverty line to say that it would be really tough to come up with money when you have an emergency situation with your pet, or even just maintaining, just sort of what your month-to-month preventative care is, that there's probably a majority of households that find it very difficult.
Hi, I'm Katie Baker. I am an animal science instructor over at Worcester Technical High School, where the Tufts at Tech clinic is. So I'm kind of on the other half. We're teaching the high school students. Lori, you had mentioned listening to your clients, basically listening to your client, listening to them and trying to figure out what they need instead of everybody just pretending that we're already experts and we know what everybody wants. So as an educator in an urban area with students who, most of our students, their parents are clients, most of our students are coming from a low income area and can qualify to go to the Tufts at Tech clinic, how can we utilize them and like our relationship with them to, after they graduate, go on to help programs like this?
How can you utilize the students?
How can we utilize our relationship with them and educating them to, after they go on, to kind of liaise in their community and let them know about these programs? How can we give them a better idea? Even like our freshmen come in and they have no idea that any of these programs exist. They don't know anything about spay or neuter. Like, they're coming in fresh just like clients would, and we're there to educate them. And so what would you like to see? So we have this whole crop of kids that are graduating every single year that can go out and be the voice for their community, and their community is actually going to listen to them, as opposed to us, and we're the experts. So how can we get our students? This is like my job, basically. How do I do my job? Can you tell me how to do my job?
Got it. I got all the answers.
Thank you. Do you guys have any suggestions? Is there any need that you see that you're not able to reach? I guess is there any demographic is there anything that any little niche that you haven't been able to fill that you're wondering maybe this could help?
I don't know if I have an answer, but in the work that Amanda and I do in Durham, we used to spend a lot of time in the community, and I still spend a lot of time in the community, meeting with people and getting to know them and their pets and finding out about their lives and what help they need. But now I spend an equal amount of time returning phone calls, because every person that we touch in the community tends to tell 5 to 10 other people, family or friends, about their positive experience, and good news travels really fast. So I think that if the students, and I know they do, feel appreciated and valued and had a positive experience, there's nothing else you need to do to get them to talk about it. They are going to talk about it. I can hardly get home without my voicemail just being full of people that says, my Aunt Betty said you helped her, and my cat's eyes messed up, please come over. And it just travels. It's so fast. So a majority, and I think it's just people are starved for it. That's obvious. They're starved. The need is so great. And I think personally that people living in poverty are very rarely treated with dignity and respect in any aspect of their life. I saw it when I was a school teacher and a counselor. And when you treat them with dignity and respect over their pet, it just, what it does is hard to describe. For them and their pet and your relationship with them. We love our pets, and we love to talk about our pets, and that's universal. It doesn't matter where you live or what your socioeconomic status is. We all love to talk about our pets, and if you connect with someone over their pet, I think the work is done, and you don't have to plan for a way to them to tell. I don't know.
Yeah, that's what I see too, is that I think that our niche with Pets for Life is that we become a consistent community presence. And that really does all of the work for us, is that we can't keep up with the demand. And I think we also have had the benefit of sort of seeing a compare and contrast in programs that aren't able to reach goals, or that maybe have a grant that they're not able to fulfill. And we're almost every single time able to track it back to they're just not engaging with people in the right way, that they're still coming in and speaking at people and not really focused on relationship building and creating that trust and listening as much as they talk. And so that's really been a big identifier for us, that if you are engaging with the community in that way that is respectful, as Lori said, and people they know that you're there just to be of service, that there's no agenda, there's no pressure, that we have these services and we hope that you take advantage of them. And on the issue of spay-neuter, if you don't want to alter your pet, that's okay. We're still going to be here, we're going to be positive, and whenever you're ready, we're here for you. And so when we do that, we really don't have an issue of that continuing.
And we just got a call 2 weeks ago from a guy we met 10 years ago who wasn't ready to spay neuter, but he was ready last week.
Just took a decade.
Just took 10 years, but he was ready, and we did it.
He called on a Monday, and that dog went in on Wednesday.
Yes.
I'm David Schwartz. I'm a practicing veterinarian in Massachusetts for a long time now. So, probably have multiple personality disorder, because I'm on the advisory at Tufts at Tech and wear a few other hats as well. But I
feel like this is a little loaded.
I just want to point out a couple of things. First, bigger picture things. First of all, I think we should all realize there's not just two models here. There's not just subsidized care and then private practice. that also, there's a continuum. And I would say most, if not all, practitioners that I know do subsidized care also for their clients every day. So it's not just one model or the other. I think we're all doing everything we can. I think we all work with local shelters as best we can, and it's part of our budget. And we are operating businesses, so we have to be careful how much of that we do. But it's not just that some people are doing subsidized care and others are not. The other thing, big picture, as was alluded to by Dr. Brown, is veterinary medicine has to be and is being very introspective about where we're going and where we've come from. And there are a lot of forces at play here. It's not just technology. We all know, that the MRIs and the CTs are now part of, that's what you need to do next. However, there's other things. There's student debt to income ratios. There's cost of running a business. It's changed a lot for all of us. There are other business models emerging now. Vaccine clinics. And to be honest with you, the vaccines in the front end of the hospital used to pay for the back end of the hospital. Doesn't happen anymore. So how does the back end of the hospital survive? We have to increase our fees. So all these conversations are part of a much bigger conversation. Mm-hmm. And I appreciate taking, drilling down on this, and I'm totally supportive of accessible care for everyone. Not just the people that need to be means tested, not just the wealthy people. Everybody needs to have accessible care, and it's a very complicated issue.
It is very complicated. I think those are good points, and if I didn't make it clear, we really partner with private practices. That's a big part of our model as well, and it has to be, because in some communities there aren't low-cost or high-volume clinics for spay-neuter, or there are clinics just for spay-neuter and not for wellness care, and so we rely on those private practices and veterinarians that have the full service in order to deliver the services.
Hey, Amanda. Kim George from Canes Crusade. It's been a couple of years. So we're in our 7th year, going into our 7th year, serving the greater Springfield area. And I think it's important for anybody that is contemplating, adding an aspect of this surrender prevention or community work to what you do. Yes, go for it. And the best thing that you can be is authentic and real to people. I mean, what's allowed a small grassroots nonprofit like mine to succeed is also because of the great people, Dakin and TJO, that are here, and Concerned Citizens for Animals. I mean, we work really well together, and we don't duplicate efforts, right? We're not in competition. We each have a niche that serves the community. That's really important. But the other thing about how we have been successful approaching things is that 85% or around there of our volunteers are the families that we serve. That's really significant. So we have a requirement with our board. We're a working board, and Hannah can tell you this. We have a requirement that all board members must do home visits every month, because we don't ever want to be in a situation where our board does not know our families and their dogs and is not in the neighborhoods, because then there begins automatically, there's just a divide whether we want to or not. And so we have a family council that's run by our families, it has a president. They organize all kinds of things. They are making crafts and other items that we actually sell to raise money. We're having an online auction coming up this fall, and a bunch of them are getting together, and they're gonna auction themselves up as a fall cleanup special, and they're hoping to raise $200 through our auction. So when you build trust, when you treat people with respect and dignity, when you give them an opportunity to be part of something, Lori, you said it so well, these folks, nobody's coming to them asking them to get involved. Nobody's asking their opinion or their experience. And, so it's not really about dog food. Yes, we have over 80 dogs that we bring care kits to every month, and a lot of that is dog food, but it's not about dog food at all. Because when we go into the community and we help these people, we're saying not only does your dog matter, but you matter. And we see you and we care about you. And so we don't serve 1 million people a year, but the people that we do serve are changed for generations.
Okay.
Stood for itself, I think.
Amen.
Testify.
Amen.
Hi, my name is Petty, and I'm a second-year vet student here at Tufts. So earlier today in Amanda Arlington's lunch talk, she mentioned that a vast majority of people whose pets never have seen veterinary care, they themselves don't receive medical care within like a year. So I guess like in a One Health perspective, are you guys considering or maybe already beginning to think of collaborations with other organizations that may provide similar services but for the owners or for human medicine?
So I should clarify those statistics, that they weren't connected, that we just know that there's overlap, that there's been a study by the government about what percentage of people in the last 12 months have not gotten medical care for themselves, and that's more, or about half people who were included in the survey across the country. And so I was just sharing that as an example of if people are unable to provide themselves with medical care, then it's very likely that they aren't able to provide their pets if they're having to go without for themselves. So just to clarify that we haven't done research or collected statistics on both of those issues. We just have on how many of the pets we've met have or have not seen a veterinarian. And so we do have that information, where it's about 74% of pets across the country in underserved areas that have not seen a vet before we had a chance to meet them. But I guess to answer your question about connecting with other agencies, it's something that we try really hard to do. There's not always the time that we wish that there was in order to make those connections, so we do the best that we can. And the least that we try to do is have a community resource list, so when we are meeting people and there is another need, or they share with us, you know, this is something that I need for my child or for myself, if we can connect them to another resource or share information on other resources that might be available. And then we do just whatever we can, and really based on time, but also just interest of a lot of human service organizations and community-based groups, if they want to work too, because I think a lot of times they're really afraid we're coming to them asking them to do more, and so we have to build trust with those agencies so they know that we're not there just wanting them to add more to their plate, but that we can be a good community partner.
I don't do that. As I said earlier, when I do help someone with their dog, they tell like 10 to 15 people, and if I help them with something else, they tell 10 to 15 people about that too, and I can't do it. I mission drift, all those, you know, I try to stay in my lane and help with pets. That's what I can do. It's not going to fix everything, but it's what I can do, and it's what I do. What I do is when I have friends and other organizations that offer services to people, I stress to them that the best way to get those services delivered is to do what I do, community outreach. Go to these homes, sit on the couches, talk to people. Don't wait for them to come to you. And I think if more agencies would do that with their service, the people would be better served.
At Tufts Tech, we very much focus on the animal in that situation and aren't doing human health care at this point in time. I do know there's a number of agencies and hospitals that are now partnering with social workers and other agents who can help advocate and provide care to the humans. It's not happening at Tufts Tech. I'd like it to happen at Tufts Tech.
Yeah, the ASPCA has tried to partner with human health service providers from the point of view of letting them know that we are working in the same communities that they're working with, and there might be some overlap. And to Amanda's point, to make sure that we're saying to them, we're not coming to you asking for help. What we're asking is that if you are helping someone and they have a pet, and in order to help that person, you need to provide something for the pet also, then think of us, reach out to us and ask us, and we will try to take the pet part of that equation off of your plate and provide whatever is needed for the pet while you focus on the human, so that we're each focusing on what we're trained to do and helping each other. But we have to be really careful that when we approach human health services, that we are not giving the impression in any way that they're asking to do, that we're asking them to do more, but rather than we're offering to take things off your plate if you end up in this situation.
And I'll add something about Lori is that she may not be looking for opportunities to connect with other agencies because she already has enough work to do, that they come looking for her. She gets calls all the time from social workers and other folks who will ask about receiving services.
I'm a second year at Tufts. And I guess so in my previous life, before I was a vet student, I worked at a shelter and like volunteered at some community clinics all the way in Oregon. And I feel like I guess there's a lot of support out there for medical care, but where a lot of dogs and cats came into the shelter was for like severe behavioral problems. And I was wondering if you guys had any perspective on how community care can address like severe behavioral, unsafe dogs, untouchable cats, etc.
Yeah, it's a tough one, and we just do the best that we can. There's no sort of great answer to that, except for we try to arm ourselves with information, so when we do have a situation that someone is struggling, that we can provide them the best advice, and oftentimes it can be about supplies and equipment as well, just having the right type of leash or collar, or working with someone on crate training, or providing just anything that we have available to us, and sharing that information with people. But that's an individual scenario, because there's so many variables in the circumstances. There can be multiple families that are living in a home, and each of them have a pet, and they don't get along with each other, but there's nowhere for people or the pets to go. They're in a small space. Or we have someone who has a dog or cat that's always lived outdoors, and they're renters, and they don't know how to transition them indoors in a way where they're not going to be destructive of property, and where people are afraid of getting into trouble or being evicted. There's just so many different pieces to that issue that it's kind of hard to have one plan that applies, and we just try to take it on a case-by-case basis and do the best we can. We don't always succeed in those situations, though, and a lot of times it's going to be up, to the individual of what's manageable for them.
So behavior is a lot harder than medicine, because medicine usually follows the textbook, and there's a tried and true plan on how to treat something, and in behavior there rarely is. But the one thing that I did want to say is, as we're doing all of this work and we're talking about preventing shelter intake, it doesn't mean that there's not a place in society for shelters. There is a place in society for shelters, and what our work is geared toward doing is making sure that shelters do the work they need to do, and not more, and not other stuff. And so as I was listening to you, one of the things that I was thinking is, if a person has a dog that's really dangerous, that really has bitten, will bite, that they can't control, that may actually be a dog that should go to the shelter. And that's not a bad thing. The shelter has purposes, and that's kind of one of them.
This question's way over my head. No, I want to be very direct. Like, we don't have a very fear-free environment at Tufts Tech. It's a very tight space. It's nothing but chihuahuas and pit bulls and some scared cats, So no, like, we're not doing our best in the behavior issue with this population at Tufts Tech.
I'll just add to this. I feel like it's kind of important to say that the extreme behavior issues are not the norm.
Yes.
That those are really a lot fewer than you might think, that a lot of things can be solved with just the proper exercise, or just sharing a little bit of information with someone about how to structure just sort of their setting. While those situations are difficult to handle, they're definitely not the majority.
And I promised myself I wouldn't answer any questions, but I can't help myself from adding that we've seen a lot of pets that live with families that are vulnerably housed, and they may seek out dogs that we may not want in our homes because they're reactive, because they're going to bark anytime somebody comes up to them. But if you're sleeping in your truck all the time and you're a single lady, that's what you want. So sometimes you end up with animals that we would label them as having a behavior problem, but they're actually the perfect pet for where they're living, and they have a person who loves them. So there's a range, just like with everything else, but sometimes some animals that aren't adoptable actually work really well with some of our settings where we work in.
Hi, I'm Emily, also a second-year student. I did I work at a small animal hospital as a tech a little bit, and I was just doing some basic research after talking to a client that was having trouble affording some care, and there are some grants that I read about online where people can apply, and it's not really pet insurance, they kind of just pay for one time of a bill, and I was wondering if you guys had any experience with organizations that provide grants, or what that system is like in general, if it's a good one.
At Tufts at Tech, we expect our clients to partner with us for care, so it isn't free care. That being said, there's plenty of people who don't even have enough money to meet our fees. And so many of our clients have used agencies like Finney's Friends, and I can't remember them all, but I have a list of like 15 agencies that they could potentially try and identify resources. And also there's a lot of people who, I don't know what it's called, where you like computer gang money from like asking for $1 from GoFundMe. Sorry.
GoFundMe.
Right?
Computer game.
Give me money. No. Yes, that happens like every week at Tufts at Tech, that an agency might help support a person to bridge the care.
We don't really have any experience with that. And for Beyond Fences and Pets for Life, we have set up our template of providing free services to people, so we cover the cost in full, and so it just isn't something that the folks who we're serving have to deal with.
Same thing for us. The vast majority of our services are fully subsidized and are no fee to the client, so that's not something we have come across.
See, she said that properly. No fees, the preferred word over free. I said free. She said no fee.
Well, because we've had it kind of. This actually is something that the veterinary community taught us, was by saying free, sometimes it implies that there's not value to it. And these services that we're providing aren't free. They cost us a lot of money to provide it. It's just that our donors have been really generous and allowed us to provide them at no fee to the client. So we have switched to using fully subsidized to indicate both that there's value to these services and also to honor our donors who are providing these services.
Hi, my name's Lauren Atkins. I'm a veterinarian. I have two questions. First, Amanda, you said that I believe it was when you went into Idaho, there were 400 animals you served and 85% were intact. What was your service time frame and how many of them were still intact when you finished your program?
So program-wide, the percentage of pets that we meet that are unaltered when we meet them is about 88%. So that's for all of the communities that we work in, Idaho being one. That is the average across all of the markets. And so we can pretty much count on any community when we get started, 9 out of 10 of the animals that we meet have not been spayed or neutered yet. And then over time, we track what's called a conversion rate for us, is how many of those unaltered pets do we end up spaying and neutering through the program. And we've gotten better at that every single year because I think we have improved in our customer service and how we engage with people. And I think there's just an increase in familiarity with spay neuter, that when you start in a community that's never had access to it before, there's a lot of misconceptions from pet owners. They've never had a pet that was spayed or neutered, and so they need time to understand what that means, to feel confident and comfortable in making that decision for their pet. And so when we started out, the first full year of our program, we were at about 58% of the pets had been spayed or neutered, and at the end of 2016, it was 89%.
Nice. The second kind of comment is that 3 of your organizations go into communities and actually work in the underserved community, and Tufts at Tech has a really stringent income screening process. So for most veterinarians, what y'all do is not seen as a competition. You don't have a brick and mortar building where you're seeing clients and you're not income screening. and you're charging quote unquote normal fees. And so I feel like it's that other population of service providers that cause the disconnect between potentially the two groups, the welfare groups and the veterinary groups. And so, what would you add to how to improve relations on those situations where groups are opening up, brick and mortar, nonprofit, or low income services without income screening and without necessarily engaging the local veterinarians?
I think that there's a place for a variety of types of programs. But I believe, and I think that what we have done in PFL and the data that we've collected shows that there is a segment of the population that no fee is necessary in order to deliver the services. And so I think that there are just layers to that. And so you're going to have a certain percentage of the population that can afford things at full price. You're going to have a certain segment that can afford at a lower price, a certain segment that can afford with the copay, and then some that it just has to be free for that service to actually be realized for a lot of people and their pets. And so I think very clearly stating what your purpose is, what audience it is that you're focused on, but then also knowing, and this is where I know the competition thing comes up a lot, is that if you don't have means testing, that there's that one person that drives around the entire country in a Mercedes. Like we hear it everywhere. And if I could just find that one woman that's driving that Mercedes that's getting a free service or a low-cost spay-neuter, because that's what everyone's afraid of. Well, what about that one person that's going to take advantage of these subsidized services? And my opinion, personally and with the program, is that if I can reach the other 99% of people, then it's worth it to me if that happens, if someone slips through the cracks or ends up getting a service that they could have paid a higher price for. And I think that that's really important for us to have that conversation with the veterinary community and to look at just the reality in our country of what percentage of people are living below poverty, what are the household incomes that people have. Like it's something that we just can't deny, and if we really want to be a fair, just, and inclusive movement, it's something that we have to be honest with ourselves about.
Yeah, for us, we right now go into the community with mobile units, but we are not against, and we actually are planning to open a brick and mortar facility in a community to be named, in a city to be named later, that is embedded in an area of the city that if you don't live there, you won't probably go there to take advantage of veterinary services, even if they're fully, partially subsidized. And so I don't know that the mobile versus brick and mortar is the difference. I think it's the difference of really being careful about who you serve and positioning yourself in communities where the percentage of people that would fit into your model that you would like to serve, where that percentage is very large, and just being careful about where you go. I don't think it's the delivery method that's the difference in whether people see us as competition or not.
Are you going to you're not going to income screen at those things?
No. Yeah, we have a whole mishmash of different circumstances, but for the most part, we location screen, so we have focus areas, and so we may have an area where all of the services at a brick and mortar are fully subsidized, and then an area beyond that focus where they're only partially subsidized. So working around it a little bit that way.
Before you ask the question,
my name is Hannah. I'm the animal control supervisor at the Thomas Joe Conner Animal Control and Adoption Center in Springfield. I'm also on the board of directors of Canes Crusade with Kim. And I'm hoping this question sort of follows up on what Lauren was asking. I know in our experience, when bringing resources to low-income or underserved owners, sometimes there's this perception or accusation that you're enabling quote-unquote bad owners. Have you found that it's important or useful to have organizational policies that combat that, or you just sort of ignore that perception and keep on doing what you're doing and know that you're doing the right thing.
You see, we all leaned forward on that one. We were ready.
We're all looking at each other going.
We don't have an organizational policy created to address talking about helping bad owners. Gosh, that's hard. Yeah, you know,
I could probably clarify that a little bit better. I mean, I guess, so if we are bringing dog food to a low-income owner who has one pet that they don't want to spay or neuter, and then, you know, they're having a hard time supporting that animal, and we're helping them with that, and then all of a sudden they wind up with another pet. A lot of people look at that and say, wow, you're feeding that one dog, so now you are giving them the opportunity to be a bad owner to another dog. Mm-hmm. So do you require that people, you know, spay or neuter their pets, or have any other policies to try and prevent that public perception?
The policy that we have to try and prevent that is just constant communication. Just if someone's getting dog food from me on a regular basis, then I'm seeing them on a regular basis, and I'm just having conversations with them about everything from affording dog food to affording additional pets. And at the end of the day, it's their decision, you know, to spay and neuter their pet. It's their decision to acquire another pet. I do get asked a lot when I present at conferences, what do you do about people who take advantage of you? And it's like, I want them to take advantage of me. That's, you know, I hear all the time, they're not good pet owners, they don't care. And then the same people ask me, what do I do when they take advantage of me? Well, they take advantage of me because they want these services for their pets. And I think that's a great thing. So I hope more of them take advantage of me. So I think I just continue the conversation with them, and I just continue to be there and talk with them. And I can honestly say that in 10 years, 2,200 dogs unchained, 5,000 spay neutered, and thousands of more helped. I can probably count on one hand the clients who have gotten free dog food and in turn turned around and said, oh, that means I can get another dog. I don't see it. It doesn't happen a lot in the work I do, and I don't see bad dog owners. I just don't. So I don't know. I don't know.
I think, first of all, that it's okay to set parameters in your program and to have limitations, because we all have limited amounts of money. So I think to say that at first is that there's really none of us, even though we're HSUs or the ASPCA, that we don't have to say this is the extent of the work that we can do. But I think basing that on judgments is a really dangerous path to go down. And I think that's what we're unfortunately guilty of oftentimes in animal welfare, is that we have our rules, or we have things that we think people must adhere to based on our perspective to be worthy of our assistance. And I think that's really what would be the most helpful to change, is the way that we approach and that we interact and the way that we see communities we serve. And if you go in with a real desire to be of service, I don't think that is the way relationships go. And I think it sort of it really is about your perspective. And we have complete control over how we interact and what we think. And I think that's one of the bigger shifts for our industry is to think of it that way. Because it can, if you feel that people are bad pet owners, I could understand that could get frustrating. But because we don't look at it through that lens, it's just not an issue.
And I'm always really honest with my clients that I'm not a bottomless pit of money, and I struggle for funding, and they know that. I mean, they know I'm stretching my dollars as far as I can stretch to help all of them, and I don't have any problem talking with my owners that I do help with dog food regularly and letting them know that if you do get another dog, I just simply can't afford to keep up. So you can, but I'm not sure I'd be able to help you if you do. And
more than what you're currently.
Yeah, and I'm just being honest, and I'm not saying don't do it because you can't afford it. I'm just saying, you know, if you do, there's a chance I can't help you with dog food, because that's just the truth.
I think it's a hugely complicated question that you're asking. Tufts at Tech is a finite space that has this teaching mission along with helping the community, and we're booked and we can't help. There's more people who want to get in that we can't help. So that being said, we run into conflict-related issues sometime among the staff and doctors at the clinic, because when you see the client who retreads with like another really complicated case that has been neglected out of resources or whatever reason, but when it repetitively happens and then they're breeding these animals and you get in a cycle where no matter how much education we pour into the situation, we can't change their philosophies to come closer aligned with our philosophies, then we get in really difficult conversations. And like the starting place of that difficult conversation is, one extreme might be if an animal wants service here, they have to be spayed and neutered. That isn't currently our policy, just so we're on the same page, but I could understand the justification of that policy if you have a finite amount of resources in that situation. But that is sort of Nazi Germany, I'm telling you, you can't reproduce kind of situation. And I'm sure that most of us aren't very comfortable with that. So we've had a lot of conversations, and where we're resting right now, but this is a fluid maneuver and we're just trying out different things, is asking ourselves, okay, we're not telling you that you can or cannot reproduce your animal. We don't have that policy. But we want to make it clear that if you are reproducing your animals, we don't want to continue providing service for all of the reproduced. You know, so like if somebody else owns it and they need service, we could help you. But it's somewhere between counseling and policy right now. And I have to be very honest with you, it's a subject matter that nauseates me. And it's something that like you want to protect the staff and the doctors, and you want to protect the finite resources, but yet you don't want to tell others what the right way to live is. And I'm not sure that where we're settled right now is the best way. I think it's going to be fluid.
And I'll just add one more thing to that, that if you do end up having some sort of policy that says these are the services that are provided if your pet is altered, and these are the services if they're not, if there's some sort of difference with that, that the key is in having positive communication with people. Because again, we do all have limitations, and so as Lori was saying, when those limitations do creep into a scenario, whether it's policy or whether it's just an individual circumstance, I think that the majority of people will respect what you have to say if you're talking with them in a way that is respectful and respecting people enough that they will understand what the reasons are. So it's not being done in a way that's shaming someone or saying that because I think this is right, you're wrong if you don't agree, but just saying these are the reasons why we have these policies. So I think that that would be the biggest thing that I would add, is that if there is a policy of some sort, that's how it would be shared.
And I think part of the gist of your question is not so much, is talking to the pet owner, but also talking to other people, right, outside, like potentially talking to donors. And I think that sharing some, we all collect data, as Amanda was talking about. We collect hard data that are numbers and statistics, and we also collect soft data, like stories that tell about the people we've met. And I think one of the best ways to talk to people who have this perception that the people you're helping may not be good pet owners is to tell them about these people and their pets. And I don't mean these people like these people. I mean these people like someone you helped, to tell a story about somebody who, needed a boost to take care of their pet, but was totally, because most of the people that we're helping, in whatever level we're helping, they're totally dedicated, love their pet, want to do what's best for them, and are every bit as good pet owners as anyone in this room, aside from the fact that they don't have the resources to provide what they really would want to provide for their pet. And so I think talking about the qualitative part of the program, about what the pet means to the family, how much the family loves the pet, and how much it meant to the family that what you did allowed that pet to feel better or to stay with them, is really, really powerful. And sometimes, especially if the story is something where it costs very little to improve the welfare of that pet or to allow that family to keep that pet. It's really impactful to talk about it that way and to be sure that people understand that 99.9% of the people you're helping are great pet owners and they love their pet. They just don't have that resource.
Okay, so Dr. Brown has forced me to say this. Talking about, no, this is,
What
no,
did I do?
no, not in a bad way. Is that this is where I think it's important for us to look in the mirror as a field, and it's hard to complain about donors or anyone saying that a pet owner is bad when we've created that narrative. That is something that we've relied on for a long time in companion animal welfare, is we've needed to create this us versus them, that we've needed to say we are here as the saviors, we are here to rescue animals from bad people. So we've created a lot of what it is that now we have to sort of figure out, how do we change that story? How do we talk about this audience that forever we've been saying they're not good pet owners, we need to find better homes, but now we're saying there needs to be support and we need to be partners with that community. And so I think it is really important for us to look at how we're messaging, and if we're still falling into some of those traps, and we all do. HSUS and the ASPCA are guilty of it.
The worst. We're the worst.
That then we have to sort of understand what the repercussions from that is and how do we start changing that. And it might just be a little bit at a time. You know, maybe instead of putting the sad, you know, poor dog that you think was hit by a car every single newsletter, maybe every fourth newsletter, put a happy story and talk about someone being a good person. So I think that we sort of created the situation that we're in, and it's up to us to start changing that narrative.
Yeah, and I think one of the clearest ways that we've created the narrative and backed ourselves into a corner that we're really trying hard to get out of is about spay-neuter. So for, I don't know how many years we ran around and saying every animal must be spayed and neutered. It was like the be-all, end-all, and we wouldn't do anything for you if your pet wasn't spayed or neutered, and if you didn't spay or neuter your pet, you didn't love your pet. And it's been really hard for us to go. We started our program as a spay-neuter program. We were originally called Spay-Neuter Operations. And part of the pushback we got when we said, you know, we're not going to require people, you know, spay or neuter their pet to get these services, to get vaccines, to get these different things. You know where we got the biggest pushback was our staff. Our staff, who we had so brainwashed them and indoctrinated them into this kind of thinking that when we had, over time, as a leadership of the program, kind of evolved and said, oh, maybe, you know, that's not really fair to force people to make decisions based on what we want, and we'll do this differently. When we started to present it to our staff, who now is with us, they've come with us, but at first we got a lot of like dirty looks from our own staff and honestly from other people at the ASPCA who said, you've lost your mind, because we had so messaged that. And I think that's really a clear example where we've walked ourselves back out of the corner, but you know, with talking about pet owners and being able to afford things, that's another way that we've walked ourselves into a corner.
I just want to jump in real quick too, and I know it's strange, but I get to go to dinner parties sometimes, and
you do,
and it's not uncommon that I get in a conversation with some like wealthy couple, and their political persuasion might be different than mine, and now I don't know if I'm going to say thankfully Obama's not president anymore. I don't think I can say that in this crowd, but when Obama was president, at every one of these dinner parties, I would hear like, that's Obamacare for animals. I don't hear that anymore now that we have a different president, whatever that means. But I think that the real big question for me is when those people start presenting the argument like that to me, I think that they're thinking that there's finite resources and that those people don't deserve those resources for those animals. And I guess the question that I would ask is, does that animal deserve comfort, health care, whatever word you want to put on it? So I think most people would agree that we don't want to see animals suffering, or we don't want to see people suffering. So if we can take it from that approach of like, do we deserve access to health care? Do we deserve food or water or air? I think then you can start changing the equation. And I think like having a group of people, whatever, 40 people come out tonight to have this conversation, this is how we make the change, you know, is talking and getting more of us on board with identifying like, this isn't about the person for me, this should be about the animal.
So, you know, it's funny you bring up Obamacare. My question is coming from somebody who's very new to the field. My name's Eric Richmond. I'm a social worker here at Tufts. And, you know, a few years ago, you never heard about pet insurance. And now most companies offer pet insurance. Tufts offers pet insurance. You see more pet insurance advertisements than Viagra now on TV. So I guess my question from someone new in the field, are we moving toward a situation where you're going to have a whole group of people with pet insurance and a whole group without, and the group without is out of luck? And part of that coming out of the fact that, you know, we're getting more and more technology, it's more expensive. I mean, when I came to Tufts, I had no idea they had an MRI for animals, or dialysis for that matter. And 10 years from now, we'll be even more advanced. So is the divide getting further with pet insurance, or do you think it's not ever really going to catch on at that level?
I know that pet insurance is increasing every year in the United States. So, but I think, like as we talked about continuums, I don't believe it's going to be black and white. There's going to be some with pet insurance, some without, some that are going full service with cash. So I think, though, you're absolutely correct. 10 years from now, the cost of care is going to be more than it is now, significantly. And as the cost of care, regardless of insurance, as the cost of care increases, all we do is leave off more, you know?
So I would go back to some comments that we made at the beginning about the cost of veterinary care, that this is a profession-wide issue, and it's something that we need to discuss. And I think the more that dichotomy happens, where there's the more people have pet insurance, the more people who want to do more and more and more, and the more that there are people, as the costs go up, that really can't afford anything. There'll be some realignment within the field in some way, because if we keep going that way, we're going to lose a huge chunk of clients that just will not, in the middle probably, that will not be able to afford pet care, and that's not good for the animals, their people, or for the profession. And so I think this is part of the larger discussion about where is the veterinary profession going, and how do we handle costs, how do we provide care.
Hi. Can you guys comment a little bit from your perspective about how you deal with the limitations on your resources? Because I think that I would guess that it puts you in a position where you kind of do have to make judgments and choices about who gets care and who doesn't get care if you have limitations. I'm guessing we all have limitations. So as you had said, that person who you're providing dog food for one dog, and they go out and get a second dog without making a judgment about them as an individual, you have to make a judgment to say, well, if I'm going to give, I'm either going to give food for that second dog, which might deny food to someone else's dog who didn't go out and get a second dog, or I'm going to have to tell that person, no, I can't give you care for that second dog. And I think for a lot of people, myself included, that's the hard part of so can you comment a little bit about what kind of challenges you face in that area of things, of how you decide, because you all have to decide to, at some point somewhere, to deal with the limitation of your resources. Thanks.
I'll start. I have the smallest budget of anybody up here, so I know that. I think the first thing is that I have those conversations before we get to where the conversations are needed. So as in the dog food, I'm going to share with that family that I'm glad I can help with dog food, but if they were to get another dog, it would stretch me too thin. So they know that before they get the other dog. So it's not as though I'm coming in and making that judgment at the time, because it does seem more of a judgment if I didn't share it up front. And the same is true. Our biggest expense each year in our budget is not the fence materials, it's not shelter fees we pay, it's not dog food, it's medical care. That's what the largest chunk of our budget goes to, is medical care. So what I do share with my clients up front is that I'm going to try to help the best way I can, but I'm limited in what I can do, and I'm going to go with them to the vet, and we're going to talk about options, and we may not be able to afford every option, and so I want them to know that before we go into it, because for me, I'm looking at possibly maybe $250 is my max for spending on a dog that needs medical care. So if it has a obstruction, that's not going to be covered, right? If it has a chronic skin infection, chronic ear infection, which are the things I see 99% of the time, great. But if it has an obstruction or an injury from a car accident or something like that, what I can offer is humane euthanasia. And that's not offered in the community that I serve. Their option prior to me and Amanda coming in and offering that was to call animal control to come get their sick or injured dog and take it to the shelter, and without them, have it put to sleep. And that's very painful for a lot of people. It would be very painful for me if that were my only option. So being very honest up front goes a long way when we get there and they realize we got to make some tough decisions. And I cannot tell you how grateful people are just to have the option of humane euthanasia, just to have a way to humanely end that suffering and be with their pet, goes for my clients.
And I think what goes along with being honest is being consistent.
Yes.
That's what we have really found with Pets for Life, is that we can't make exceptions. And so we have in writing, we've agreed to, these are what the parameters are that we are working within. So things like flea and tick medication, dewormer, antibiotics, ear infection, those are all things that we know we can cover no matter what. We have budgeted our program for that. We are managing our outreach to reflect that. So we're not promoting on social media. We're not putting things out in the newspaper. We only are advertising services through our community outreach. And so we know how to sort of that formula of, okay, if we are meeting 50 people a week, we know that what we're going to run into is about what we can cover. And I'm using 50 as an arbitrary number, but we've just figured that out. And so we can really manage how many people we're meeting and what percentage of those we know are going to need different types of care. We've collected that data. We've really studied what we're seeing and to inform our work. But then in doing it, what Lori's saying is to be open and honest up front and to not stray from that. And so over those things that we have listed that we know we can cover, if there's a medical issue that is on top of that, then we have a number that, okay, if it gets to $200, $250, that's where we have to really talk about the scenario and what we're able to do. And if we make an exception for one pet that needs cancer treatment and it's going to be $2,000, we've just found that that's really unfair for the community when we can't do that again. So we make decisions on what we know is sustainable for us. And as hard as it is in some situations where, I think we all connect with a certain dog or a certain cat, and if we don't keep each other honest, we can stray from what it is that we've decided. And it never fails. When we've done that, and we've made those mistakes, it's not fair to the community. And
it sounds very similar to the private practice veterinarian who's also made decisions about what's sustainable for them and what they can do and they can't do.
Yep.
It's and the hard part is when you get someone who's on the other side of that line.
Yep.
of you also are forced in a sense into a position of at times having to say no.
I think that it's important for us to be realistic and to set reasonable expectations of ourselves, is that the issues that we're talking about are so much bigger than what it is we're able to really address, right now. And I hope we'll get better and better at that as a field. But right now, there's always more to be done. There are always more people and more animals that would really be happy, and it would be, helpful for them to receive the services. And so we just have to figure out like what we're able to do now and stay focused on that and hope that we can continue to grow it. But the key really is the way that you connect with people and the way that you communicate with people. I think, of tens of thousands of people that we've served, almost no one ever gets upset whenever it's shared, this is the extent of what we can do, because we've been really honest and open about it. And even when we can't, that doesn't mean that we're not there to support someone emotionally, or that we don't hold their hand through making a tough decision. So we can provide that free of cost. But just being really open and honest and transparent with people, that's really the best that we can do. And I think what that ends up being is really hard on us too as a service provider, that it can be emotionally draining and it can be really tough. And it's helpful to have other people that you work with understand that. And I said it earlier, but I'll say it again, it really helps to drink.
Adam, I want to comment to you. Tufts Tech is really, it's awesome, but in some ways it's really difficult. And sometimes I feel like I'm sort of like skating on a razor, because in one sense I have like an MVMA organization that cares about what we do. The school certainly cares from a PR perspective, local practitioners care. So how do you keep everybody happy and make sure that you're meeting your goals? And the important part for me is the goals are teaching students how to be future veterinary caregivers and helping a sliver of the community. And this is really critical. We're so not helping the majority of people who need help. And I recognize and appreciate that. And while it's tragic, it's not my responsibility to solve the entire world's problems. So that being said, every day I have to tell, usually it's the veterinary students communicating with me, and I have to tell them, no, you can't do that. That's not a reality in this environment. I say no 20 times a day, at least, I bet. But that veterinary student, it sucks for them, because now they're in the meat grinder of this client has need or expectation. They have an imperfect situation to make it happen. And then they have to go and discuss the flexible treatment plan and sort of, these are your expectations and this is reality and what are we going to do? And while I feel really bad because that veterinary student is getting the mental burden of that communication, I also feel awesome because I'm training that veterinary student for the reality of tomorrow when they go and work in your practice and have to make these same exact decisions. So saying no is a muscle that we all have to exercise in this profession. And if we had unlimited resources, we wouldn't have to break out the no, but we do.
And I don't want it to be all negative, because there are so many situations where you are able to provide the assistance. And so it is important for us to focus on successes and to not just let that maybe 1 out of every 10 situation where there is a much deeper need that exists. It's not, just the services that you're able to offer, that you don't forget about those, and that we let the ones you have to say no to overshadow the ones that you don't. And that we just, our mantra that we operate on constantly, and we sort of drill it into our own heads, we say it to each other, is don't let perfect be the enemy of good. And there is so much good we can do. We'll never get to that perfection, but I hope that it doesn't stop all of us from doing the good that we can.
Yeah, we actually have very clear medical guidelines of what we cover and what we don't cover for our department, and we're working on developing something for the ASPCA as a whole. But what I would say is what we decided really early on was that sometimes what we could give owners, even if we could not treat the problem that their pet had, what we could give owners was information. And we could give them enough information to be able to make an informed decision about their pet. And that is truly a gift, even if we can't solve the problem. And so what we often tell owners is, we don't know what's going on. We're going to do blood work or we're going to take an x-ray, but that's no guarantee that we'll be able to follow this case to its conclusion. We might find something that's beyond the scope of what we're going to treat. but at least then the owner has the information to make the decision about whether it's something they could take on themselves, whether it's something that they can't take on, and then do we need to discuss humane euthanasia. But I think what we decided, as I said, what we decided really early on was, as veterinarians and as a veterinary program, one of the things we could offer was information.
Yep. And I'm just going to add one more piece of that. It's not always financial. I think that there are a lot of other considerations and circumstances that we have definitely learned that lesson the hard way, is that just having money doesn't mean that you have come up with a solution that's viable, that it's really understanding people's situations. And so if you're doing a surgery that's going to require 3 months of crate rest, is that home set up to be successful in that? And are we setting people up for success if we're making that recommendation? And so understanding people's lives and what their situations are, and really talking and hearing what that is, I think is important too. And again, like that, we really have messed up before and being able to cover something, and then it was not a good situation after the fact, that either the aftercare was too complicated or just the living situation was not conducive to it. And those are some of the biggest regrets that I have, are setting people up for failure. And I think that that's the opposite of what we want to do.
And the flip side of that is that a lot of people who can afford care get care and don't provide the aftercare, even though they've paid for the service. They're not good at compliance after coming to the veterinarian, right? Like, every veterinarian in the room knows someone who financial needs or financial issues was not the reason why they didn't comply with aftercare or come back for a recheck or do whatever they needed to do. So the population that we're working with now is really not any different than any other veterinary practice population. They have the same challenges, and some will be great at aftercare and will, do everything you say to the letter, whether they needed resources to provide the initial care or whether they were able to afford the initial care. So I think thinking about the clients that are served by our programs as the same in 99% of circumstances, they're the same as the clients in any other practice. The only difference is they need subsidies to afford the care, or maybe transportation to get to the care. They need something beyond what some other clients might need.
I don't see any hand. Oh, a hand.
Totally, dude. Every time I get on, I want to go send you the high school football rules.
So I actually have more of a comment or statement than a question at this point. I feel like this is a good platform to kind of bring this up to a bunch of veterinarians, private practitioners, and also shelter veterinarians. So, as I stated before, I've worked in shelter medicine and spay-neuter clinics. My next career endeavor is going to be opening up a clinic. It's going to be very similar to a high-volume spay-neuter clinic. However, I'll be offering more types of surgeries than just your spay-neuter, so that foreign body can come, or whatever the case may be, within reason, obviously, and also dentistry. However, this is not going to be a nonprofit. It's going to be a full-service clinic. Well, I guess I shouldn't say a full service. I guess it's going to be specifically geared to providing surgical and dental procedures. So I guess I just want to throw that out there to the private practitioners, because I know that we've been talking about competition and also the working poor, and I think that we're starting to get a decent handle on providing care for people who are below the poverty level. But I think me personally, I feel the bigger need is actually with the rest of the population that we're completely missing. So my goals is to, again, do what we're talking about, preventing economic euthanasia and preventing more animals from being surrendered. So I'm hoping that by stating this out loud that there will be people that will communicate with me, because I'm not doing this because I'm looking to take competition or anything like that. I want to be able to help that animal so you can service that animal for 10 more years if it's a puppy who ate a ball that needs a foreign body foreign body surgery. So again, I just wanted to use this as a platform to kind of say that out loud so we could start to have a conversation and create a positive relationship. And I do plan on making that step in the area where I'm going to be in Massachusetts and communicating with those clinics around me to hopefully we can start that positive conversation. And by all means, if you guys have any comments or thoughts on what I'm going to be doing, it is a scary endeavor, but I think it's going to be an overall positive experience, and I think I can make a real impact. So.
I say good luck. I hope that you're wildly successful. It's really needed.
I should also say that I don't know if I said this, but I do not plan on income screening. I probably said that, but I don't remember if I did. So I do not plan on income screening. So again, that might also spawn more conversation, which I do want to happen.
Can I make a suggestion? As you get started, this is something that I have found, and this is, now I've already said it, that I think sometimes veterinarians aren't always good at collecting data. And so maybe from the beginning, like, collect information on what you're doing, because I think it would be useful to share with other veterinarians, as there are these different models that are emerging, to really have the information that others can learn from. And so just thinking about that as you're getting your business off the ground, of looking at, what you can collect that can hopefully show others, when you are successful, because you will be, how they can do it too.
I have a question, comment. Tufts at Tech, might be able to do a dystocia or some bigger surgery for, $300 or $400. And I know that that's much lower than the traditional fee service at most private veterinary clinics. And I was curious, did you have a fee structure target, or do you know how you're going to either reduce the cost or make it competitive to those local practitioners? And how's that friction gonna come about, I guess, or how do you hope there not to be friction in that fashion?
Well, it's a big question. So I definitely have a tiered system. So for my business plan, I kind of separated them into different tiers. So from spay neuter to foreign body surgeries, splenectomies. So there is a tiered system, and I have kind of it set up in kind of easy, medium, hard, so to speak. So I do have a system, a fee scale in place at this point. As far as keeping costs low, this is again a personal opinion. I think far too often veterinary clinics are just housing way too much diagnostic materials under one roof. I commonly look at human medicine, and although that's not very great either, but if you need a radiograph, you go to a radiology department or a clinic. You need to go to the dermatologist, you go to the dermatologist. You go to that specific office. So I'm setting up this clinic like a surgical clinic. I'm not going to do a lot of preventative care unless it's the time of service. So I'm not going to have a radiograph machine. I'm not going to have an ultrasound. I'm not going to have a lot of diagnostics. And that's where the private practitioner folks are hopefully going to play nice with me, because then we can work with each other. And obviously I'm going to only stock at what I absolutely need. I don't need to have everything on the shelf, so it's going to be run. So I guess that's what I said when I say it's going to be run like a high volume spay neuter clinic. They stock what they need. They don't stock anything extra. Does that make sense? Does that answer the full question?
So quick question. So are you assuming that the dog with the foreign body will come to you already diagnosed with a foreign body somewhere else?
Yes.
Okay, so I worked at a high volume, low cost, for-profit clinic right before I came to the ASPCA, and we would sometimes get general practitioners or even referral hospitals that would have something like a foreign body or a PIO or, a fracture, something that the owners couldn't afford to treat there, and they would call us and say, oh, we're going to send this over, because they knew that instead of $2,500, it might be $800 to $1,000 if they came to us. And so I think that model can work, but you, I think, should be prepared for it to take a long time to come around, because local practitioners may eventually get to a point where they will refer to you, but that's not going to happen right away. And so you might want to think about doing wellness and preventive care and some other things, because that might come around right away. But other clinics sending you their PIOs and foreign bodies, first of all, I don't think that's going to be enough for you to survive. And second of all, even if you can develop a large enough volume for that to be the majority of what you do, it's going to take a really long time for that to happen. I mean, we talk about, even with our spay-neuter clinics, the if we build it, they will come philosophy. And, we start with that, and then it takes like 2 or 3 years for our clinics to fill. I think what you're doing is a tough nut to crack. And if that comes around, it's going to take a long time for practitioners to see you as a low-cost resource. Oh, God, that was so New York. To see you, I'm tired, it's late. New York is coming out. To see you as a low-cost resource for their clients when their clients can't afford their services. So I think that's a tough thing to build around.
Yeah, no, I absolutely agree. And that's why I plan on reaching out to rescues and also heavily marketing spay-neuter in the beginning, because I think that's what's going to keep me sustainable until I gain the trust of the private practitioners in the area. And I definitely know it's going to be tough. That's why it's so nerve-wracking. Thank you.
Hi. So I'm Veronica from Concerned Citizens for Animals. We started doing spay and neuter back in 1977 when there was a large need in the Springfield area. It's not as big a need right now for Springfield, but we do all of Western Mass, where we help with area vets. We actually have contracts with 25 to 30 vets that, from their private practice, allow the surgeries on a voucher system, and then they get paid through us. But one of the things we're also helping now financially when we have the monies. If we get a phone call, someone needs meds, somebody needs a surgery, we work together with Canes Crusade, which is an excellent thing to do the networking and know the people in your community. So one of the things that I'd like to see is more resources available and where to go to one place. I've recently been on the other end with a dog that needed a TICA, bilateral TICA. And if it had not been for Dr. Wolfus, I don't know where I would have been. I screened approximately 25 people in the public community, and vets that I knew personally that had done surgeries for us when I was doing rescue. And it just became overwhelming. Like, what was I going to sell? Which leg was going first to be able to get this dog surgery. So if I had more resources, I think, and I did use the computer, but it's difficult to maneuver for somebody that knows the system. And so if we had one place that we could put everything on a computer or through Tufts, anywhere, it would be really beneficial, I think, for all of us here. And thank you all for having this tonight.
Thank you. You're OG spay-neuter, I like it.
She doesn't know what that means.
We've talked a lot this evening about what we do, what we don't do, what we do when our resources are limited, etc. But I'd really like to hear from each of you how you determine what your communities need and how they might differ from one another. Because I think, I mean, just from my own experience, making a lot of assumptions about what I think the community needs is not necessarily the answer, and learning to check myself, as you said, Amanda, looking in the mirror and who are we doing this for? So I wonder how that has evolved for each of you.
I have an answer. I don't think that we appropriately knew our community's need. We had some ideas and we knew that they had need, but we had the delusion that maybe 2/3 or 3/4 of our cases were going to be well cares coming in for vaccines, and it's a 180 from that. The majority of people we see have healthcare sick needs, and they need vaccines also. But so even though we had outreach, and even though we did a lot of planning and a lot of thought, we also had what our needs for the students were, and we knew we needed to get more primary care and preventative care on board. So that was where our mission sprung board, but that isn't what it became. So I think accepting that we don't know everything we'd like to believe is hugely important, and then having an audience that's flexible enough to let the mission evolve. And I mean, we still have the same mission. It's teaching veterinary students how to do primary care stuff, but maybe at Tufts at Tech, the primary care that they're getting is a lot of sick and complicated primary care, which happens in traditional for-profit veterinary clinics. And like, it's the academic institution that is like, oh, primary care is just vaccines. It's like, no, they're not all just doing vaccines out there. So, it's just regrouping.
And I think trying to, as much as you can from the beginning, listening, we've said that now multiple times, is really getting to know your community and listening to people and not going in with assumptions. I mean, Beyond Fences did exactly that. We went in to build free fences for chained dogs, having no idea the wide array of needs that the community had or what it was that they would like from us. And man, did we learn that really fast, because we were willing to listen, and so people were willing to tell us. And I mean, it was really eye-opening and shocking for us of what we thought from the outside looking in, and then going into the community and being willing to say, okay, we really don't know as much as we think we know. And if we can impart that on others as you're doing your work, as you're growing a program, as you're starting a program, to try to, as little as possible, assume what it is that you think needs to be provided, because you'll almost always be surprised. So I think it's just really important, like you said, to be nimble and to go in with a desire to find that out from the community. And it's not just about medical care. I mean, one of the biggest things that we provide, well, not the biggest, but it's become a big piece of our work, is pet deposits, working with people on landlord interventions, covering return to owner fees. There are so many animals that still do end up in a shelter that are labeled as homeless but are not homeless. They have people who care for them, who want them back, but either they're afraid to show up because they're going to get into trouble, they're going to receive a citation, or the fees are just out, they're just too high. They can't afford that $100 to cover to get their pet back home. And so those are ways that we've really evolved, as medical care is still the biggest chunk for us, but we've learned all of these other sort of peripheral things that really impact people's lives. And we don't even have time to get into it tonight, but it's where we have found such value, and I encourage you guys to think outside of animal welfare. I know that's the space that we live in, but especially when you're working with underserved communities, to understand all of the challenges that people in poverty are face and why underserved communities exist to begin with. What are the governmental policies? What is the history in our country that has created segregation, that has created mass incarceration, the issues with immigration? There are all of these things that impact the dogs and cats that you meet. And the more you understand those things, the better you can be of service, and the more it will inform your work in a way that's going to be the most impactful.
What she said.
So I'm a little apprehensive about answering this question because it was asked by my boss. So we did some studies, we did some surveys in areas that we were about to start to work in to get some ideas about what the community needed what they thought they needed. And I think the biggest thing is to whatever you start with, and I think, Amanda, you kind of said this, whatever you start with may not be what you end up with. And just be willing to flex and change and provide different things. And I think in the two communities that we work in, New York and Los Angeles, it's not so much that we provide different services, it's that the way in which we provide them is different because the community is different. And so that may seem subtle, but it's actually a pretty big difference in our program between the two cities. And so as far as medical care, we have a pretty short menu of medical stuff that gets provided in these programs, right? But sometimes where and how you approach it is really the difference from community to community.
Hi, I'm Erin King. Sort of to piggyback on that concept of going into the community and working and really taking that deep listening, what would your advice be to gain access to these communities? Like, what are your gatekeepers? How do you really get into the community and make that? What are the tangible steps you would recommend into that process?
It's actually the easiest question tonight. Is just show up and be nice. It's that simple.
It is that simple.
But it is the number one thing that we avoid. I cannot tell you the fact that we have the benefit of working with groups all across the country. It is still amazing to me how much an organization will fight just doing that. They'll try everything else first. They'll talk about marketing in this way or putting out the message in another way, and we'll keep saying, I think it was someone that asked today about how they've seen studies about folks in underserved areas having smartphones and accessing websites, and so how should we set up our website? And really, you don't need all of that. If you have a presence in the community, it is everything that you need, and you will end up having more than you can handle. And I know that that's not always available for people, but I think that it's something we should make available. We should look at how do we start to restructure our missions? How do we reallocate resources at being proactive instead of reactive? There are ways that we can slowly start to do that. And I have absolutely no doubt that the more you are in a community, the more you become embedded in and part of a community, it still amazes me how welcoming people are. That doesn't mean that everybody is nice, but everyone's not nice in my neighborhood. Everyone's not nice in your neighborhood. So I'm not kind of saying that it's just this sort of, nirvana of acceptance and welcoming. But I think that the majority of the time, if you go in with a genuineness and you are there not to take people's pets, not to get them into trouble, not to judge them, and you're showing up, it's really that simple. That's not a complicated answer in my experience.
I would like to add on to, and this isn't from experience, it's from observation. I think partnering with agencies that are already doing good in those communities, whether it's a church or a religious organization, whether it's a housing authority, whether it's a soup kitchen, wherever it happens to be, that there's a population of people who might be congregating, who might have need but not know. If we publicized at Tufts that there's a low-cost clinic in Worcester, the clients that would be serviced in Worcester probably aren't seeing that website as very much, But if we go over into their community, we're going to start getting head play based on word of mouth.
So I'm sensitive to the time and the fact that a number of our guests have an hour plus drive. So this is going to be the last question.
No pressure.
Make it a good one.
And I volunteer at the animal shelter in Medfield. I also run a local food pantry. So I kind of had a response to your thing, piggyback on what Dr. Wolf has said. There is a need, and we usually know what it is. If you go to a local food pantry or a soup kitchen, there's tons of people, and we already know our clients, and we already know their pets. And we've been partnering with people to provide food for them, and we just need a little extra help because we don't have the resources to provide health care. I know of several animals that their humans come to my food pantry for food for themselves. But if they're coming for food for themselves, it's unlikely they're going to be able to afford even a rabies shot, much less a spay or neuter for their animals. So it's not that that's not that difficult to connect out there, because there's a lot of people that already are working in the community and would love the help for the people's pets.
So I do want to take a time to thank the panelists, but I also want to thank all of you guys and for coming and just kind of having this kind of discussion, because I think, you know, a lot of people alluded to, it's a really complicated problem, and it's not a problem that veterinarians can solve themselves, and it's not a problem that animal welfare can solve. We really need to work together, and it's oftentimes, I think, we get stuck because we frame it as, well, what am I not doing that I should be doing, or what should I do differently? And it's really a profession-wide problem, and so the more we can have this kind of conversation and kind of understand where each other is coming from, we're going to further make progress, because what we really want is for every pet in America to get the kind of care that our pets get. So thanks to the panel.
Thank you guys.